This one has to do more with the behavioral side. It's very important. And offense or defense here, offense or defense. When it comes to developing the skills to have crucial conversations, developing the skills to have crucial conversations. And those crucial conversations, Naren, could be with team members.
Yeah.
It could be with an associate doctor. It could be with a patient. It could be with a specialist that we work with. And that's become very timely, Naren. The reason it's kind of on my radar is, as you know, we do book club with our clients.
Yes.
And the next book that we're reading is the book, Crucial Conversations. And I have to say, Naren, when it comes to a behavioral skill set, if you think of you having a tool belt on, I'm sure you've had a handyman do repairs at your house.
Yes,
yes. They show up with the tool belt. And
yes.
It always amazes me when they have exactly the tool they need to fix whatever the problem is in your practice.
Yeah.
So if you think about your behavioral tool belt, one of the tools you want on your tool belt is the tool of having effective, crucial conversations. Now, how does this relate to offense versus defense? If it's defense, you might be just thinking, well, I'll just wait until it comes up, then I'll deal with it. If you're on offense, you're going to say, I'm going to develop the skills ahead of time, so when it does come up, I know what I'm going to do, and I know how to handle it, and I know how to do it successfully.
Two things. Let's, if you don't mind, add the link to the book, Crucial Conversations.
You bet.
And the other point I want to make is this is the hardest one, at least for me. I tend to not deal with these crucial, difficult conversations. If I were to use a different, like all the other things you said, Gary, I would get behind. But this one, I think I need to still work on.
Can I explain why?
Go ahead.
It has to do with your personality style. And this relates to a lot of dentists. When we look at the DISC personality styles, among dentists, they're disproportionately S's and C personalities, S's and C, because they do really well with details. They do really well with data. And there's many, many positives of having an S or a C as your dominant personality type. But one of the things to work on the S and C personality type is they don't like confrontation. They tend to be confrontation avoiders. So, if your career counselor knew this information when you were looking at selecting a career, they would say, Naren, don't decide to be an attorney because that profession is dealing with conflict all the time successfully. Yeah. And your personality type, that's hard.
Yeah.
And so that's why I think this is a good one, doctors, for you to go on the offense on. And it's the offense of developing the skills to have those crucial conversations. And Naren, I can cite any number of examples where Paul, Tim, and I, because we've done work in this area, have had very productive, crucial conversations with team members and supported them in improving in our practice. But avoidance is a tactic. To avoid something is a tactic.
Right.
But it's generally not a tactic that produces the desired result, especially if it has to do with a team member that needs some correction. Because if you don't address it, you are addressing it because you're telling them that whatever they're doing is okay.
Right.
But you're in a passive way, in a defensive way, passive. You're telling them whatever it is that you're doing, it's okay because I'm not addressing it. But instead, if you develop the courage to address it and address it in a constructive way, it can produce amazing transformational change. But first of all, you have to learn about that.
I'm reading that book for the third time now, so hopefully I'll get a few things really.
It's breakthrough. It's absolutely breakthrough. Hey, if you enjoyed this video, make sure to like, subscribe, and leave a comment to us saying I subscribed. Most importantly, be sure to click the bell button which means you'll be subscribed so you won't miss out on any future videos.